We are live. Big question for tonight, guys. What would you give? What would you do for a second chance to save them? A loved one, friend, family member? What would you do if you had a second chance? This story comes from something that happened to me and my wife not too long ago. And it was about 2 years ago. We just moved to Maine and it was date night. And typically for date night, we kind of decide what new place should we try. And it was only by happenstance that we chose a restaurant that was not the same restaurant as one of the gunmans that happened in Lewiston, Maine. And not only did they come in at a restaurant, but they also hit a bowling alley. And several people were unalived. Several people were injured. And the chaos that ensued, both from the ambulance perspective, but also from the emergency management perspective, local ERs and small ERs were just overwhelmed in an instant. And when that happens, an ambulance, if you are not first one to be seen, first one to be triaged, it is very hard to save multiple people at the same time. There's only such amount of people that can fit into one ambulance at a time, and to establish a perimeter before you even get there safely. So it was a very scary moment for us because we realized, even though we were moving to one of the safer states out here in the US, and we were hit with someone who was crazed, you know? And the scary thing is that 2 years, fast forward 2 years, it happened again 5 minutes away from our home. And we live in a suburb, very normal place. And one of my buddies that I train with, him and his kids were 10 feet away from another person who was murdered in broad daylight in public in front of a McDonald's. Crazy, crazy stuff. So that begs the question, what are you willing to learn? Who are you willing to become to save lives? And that's going to be the topic for tonight. So if you all can hear me, give me a thumbs up in the comments. Let me know where you're coming from. Let me know your training levels, because this is for people just like you. One of our last students, Mary, she was browsing the internet, finding people on YouTube, on Instagram, learning these little tips and tricks for medical management. And for the most part, she knew a few things. But at the end of the day, she was frustrated because she still wasn't confident if that would happen to her own family member, that she would be able to step up and to manage that. And she felt vulnerable. She felt scared, but she felt like she needed to do something. And once she had enough, it so happened she found me on social media, found one of my videos, joined our 5-day Stop the Bleed program. And she learned that it's not just about collecting small little tips and tricks and skills here and there. She learned, and we taught her over the course of 5 days and 5 hours, that it's not about the individual knowledge, the individual skills. It's about building a system. And that's what I'm hoping you guys learned today. Because do you know what happened on day 2 of the Stop the Bleed challenge for Mary? Her son fell off the roof, slit open his wrist, and had a very brisk bleed. Without hesitation, she acted, she stabilized, she got them to the ER. And she was able to share it in class day 2, which was amazing. And that is my hope for all of you. That's the level of confidence. That's the level of training that I want you to be sure of to intervene and to save lives, both in the general community, but also for the people you care about. So is that cool if I show you a system and my approach to bleeding control? Let me know in the comments. So this presentation is for anyone who works in the public sector, whether you're a doctor, a nurse, a first responder, a policeman, but also for your everyday people who just do a bunch of DIY projects like myself and who have kids, who have people who they care for. And if you stay until the end, I have 2 promises for you. Promise number 1, you're going to get a surprise. I'm literally giving Let's see. I have a tally of the value that I have. Over $9,155 worth in value for you guys. And not only that, I'm going to give you a way to learn these skills within this week. So this week you will learn how to save people from massive bleedings. Is that cool? So, who am I and what is the overview? So today we are talking about number 1, how to know when a bleed is life-threatening without having any medical supplies. So, I have very poor penmanship, so excuse me for that. Number 1, what is bad versus very bad in regards to bleeding? Number 2, how to apply life-saving skills even though it is your first time, your very first time doing something like that. So, number 2, we're going to go over first time jitters and how to frame yourself. And number 3, what if you just don't have the stuff? You have no gear, and not only that, even if you might have one tourniquet, what happens when you need another? What happens when there's more patients? And what happens when you're not sure when rescue is coming or when the ambulance 911 is coming? So that's what we have on the docket today. And I hope you are stoked because I love this topic. My name is Dr. Teimojin Tan, and I'm an ER doctor, still working full-time, Army veteran, Stop the Bleed Instructor, and survivalist on History Channel's Alone Season 9. But that's all cool. My thing that I want for you today is to share an actual framework and a way of approaching things so that you can piece apart all the things that you might have picked up, take away all the bad, and have a system to apply and to basically treat confidently. So, the way I'm going to break it down in those 3 marks is number 1, we need to know what is a massive bleed. Can anyone give some guess? We got people coming from Ontario. Welcome, welcome. Penmanship is proof that I'm a doctor. Absolutely. But a massive bleed, this is super important because our treatments, whether it is in different parts of your body, is highly dependent on whether it is a massive bleed or not. Because if it isn't, some treatments just wouldn't be the best. It would cause a little bit of harm for not much benefit. And the way I see it, I can eyeball what a massive bleed is going to be within a mere seconds, and so could you. So number 1 is it arterial? Is it a pulsating thing that is squirting out just like in the movies? Number 2, is it an amputation, whether at the arm, at the legs? Because that is going to be very hard to control. And number 3, the first reaction you should have beyond making sure the scene is safe, making sure that you are safe, having protective gear if available, is direct pressure. And very quickly, you will see that whether you're using gauze or a rolled up t-shirt or a rolled up sweater is how fast that's bleeding despite direct pressure. So again, is it squirting at you, arterial? Is it an amputation? And is direct pressure failing? And if it's either of those 3, you got a major bleed on your side. So the treatments you do is a little bit special. We're going to talk about those today. But before we do, I want to talk about a little story because not only did I go through medical school and all these things, the crazy thing is the first time I was at risk for a stop the bleed moment was actually in the military. And this was during training. You basically learn how to shoot at different ranges. We were at 300 and we all have different weapons. Some people have an M16 with a M203 grenade launcher on it. Some people just have the M16. Some people have light machine guns. Some people have heavy machine guns. And we're all running down the lanes, practicing going from 300 to 200 to 100 to 150 or to 50. And the range is typically controlled by someone who's yelling out commands. And I remember one day we were running and our machine gunner, who is a little bit slow, and albeit the machine gun is a lot heavier, starts firing as we're running. and we're just hearing whistles behind us over ears. And this is early on, early days. We don't know what's normal or not. And that was one of the scariest things in retrospect because there were literal hundreds of rounds going down range. And in retrospect, as a doctor now, looking at our medical kit that we had over there, we literally had pressure bandages and things from way back when. So definitely decades and decades of old, and nothing that would actually help immediately. We didn't have any tourniquets, nothing like that, no hemostatic agents, nothing like that. And it was really crazy because not only did we not have the stuff, the only people who were trained on that were people who have gone on tour or who were training to go on tour, meaning they're going to Afghanistan, they were going on Iraq, they're revving up to go there, and that was part of their training, the medical side of things. So I'm sure our instructors knew what to do, but none of us, if one of us, multiple of us got hit by a bullet, it would immediately be overwhelming for our staff, which was maybe a handful of people for a section or more of soldiers. And when we're thinking about that, you're thinking about, I've never done this before. How could I do it? And it brings me to a situation that I had with one of our medical techs in the ER that I currently work at. And she is awesome. Every time there's something, a procedure to be done, she is first in line wanting to assist, wanting to help. And unlike Mary, there was another patient who had a radial artery bleed. And this was an infection issue. There was multiple different things, but it was squirting. And they tried direct pressure for literally several hours and no help. And they kept on losing blood, losing blood, losing blood until they felt lightheaded and pale and they came into the ER. And one of the things that I was super excited to teach her was to stop the bleed because that's our bread and butter in the emergency department in traumas. And without any training, she's a medical tech, so not a nurse, not on that track, doesn't have the training for it. I was able to coach her in the moment as this person was bleeding, as the blood was pouring over our floors, and just the simple tips, the whys, and how you can calm down the situation so you can think clearly was enough for her to do it for the first time. So that's what I'm hoping for you guys, because when you know the the whys and the whens and the wheres and the hows of how to do this, it becomes just something that you need to do. The blood fades into the background, the noise fades into the background, and all you have is one task, one mission, and one life to save. So, location. Location and techniques are super important and will be the distinction of what you do in that moment. So, location, who can tell me about the location of bleeding areas for bonus points? One of them, arms and legs, right? If it's an arm or a leg, treatment is one thing. Number two, a junction. So, meaning, is it your neck, which we've all seen the assassination earlier this year. We've all seen that stabbing in the metro system this year. Neck bleeds is trending right now. And for good reason. It's a very scary type of injury to have. So that's a junction. But do you know what another junction is? Armpits. You can't put a tourniquet all the way up in the armpit. So armpits is a junction. And even scarier, kind of groin bleeds. So groin area. Right there. And the reason why it's super scary is because if that artery is completely cut through and through, and it's cut really close to where that ligament is, and it slips, the artery slips into the pelvis, there's no way in a pre-hospital place that you can go in and put enough pressure to stop that bleed. So very, very scary type of bleed. So that's a junction. And the third kind of category, and I'm going to do a broad category, is everywhere else, thinking about chest, abdomen, and so forth. Because when we're thinking about locations, it tells us which technique to use. And the techniques that I'm going to introduce to you today is for extremities. We talk about tourniquets, right? These guys. Second, for junctions, it's wound packing. So think about the rolled gauze, and you're literally shoving material into the wound. And three, it's kind of an adjacent to that, is putting hemostatic agents. So hemostatic agents help clot the blood faster. So you use that in combination with your wound care, pressure dressings, and also wound packing to help combine the effects. And Celox, if you guys are looking to get stuff, has the most evidence to actually decrease your chance of dying. So that's the ones that I recommend right now because it has the best evidence for, even though combat gauze and other types of gauze that are hemostatic agents have been used for a long time in wartime scenarios. And I would say the fourth would be just direct pressure. Pressure for bleeding is king. There are many effective ways to stop a bleed, but there's even more ways to slow the bleed. And we'll see with tourniquet use, you can slow a bleed, let's say with a belt, which some of you have seen my videos. You can definitely slow a bleed. But if you know why a tourniquet works, then you can make a device. Learning why things work is super important. And that gets to our fourth point, improvised devices. What do we do when we have a tourniquet? We put a tourniquet on, but it's not working. You need a second one. And with that second one, I'm going to review how keen it is to know the whys. And we're going to do this just for one case, right? Tourniquets. So, how do tourniquets work? Any ideas on what makes a good tourniquet? Awesome. Gen X Gemini, I see someone that I'm familiar with. Definitely improvise windlass. A windlass is this guy over here. So you see that metal rod over here? That allows you to, as you're wrapped around something, to twist it even tighter. So a tourniquet, number one, needs a way to tighten. So whether that's from a ratcheting thing, so think about like maybe your car ratcheting thing or your truck ratcheting thing, that could definitely tighten. But what's another characteristic of a tourniquet? So one thing that you might notice is that it's thick or wide. The wideness matters. And this is a point that a lot of people don't get, because some people, when they think about improvised devices, they go for their shoelaces or rope or something like that. Why do you think that's important? Because we know if you have a rope and you're trying to strangle someone, that's going to be pretty impressive. It's going to cut off blood circulation. It's going to cause a lot of pressure. But why isn't it really good for tourniquets? One of the reasons why is, even though a very thin material causes pressure because it's a force with a small surface area. So for you physics people or people who's trying to remember what they learned in high school and in university, pressure factors in the force, but also is evaluated by the surface area. So a small surface area, just like your skates on ice, causes a lot of pressure. But the thing that people miss is to actually stop blood flow through your arteries. There's another factor that you need to take into account. And that factor is the actual flow in the blood vessel. Because even though pressure can squeeze it at one tiny sliver of a point, actual resistance against that flow is better if there's more surface area compressing that. So when we think about this, a good way to experiment, if you haven't seen my video already, you can get a straw and try to pinch it between your nails. You'll still be able to blow air out. But if you compress that straw between your mouth or between your palms and try to blow out, it's going to be very hard to blow out because of the surface area and the amount of blood vessel itself that is compressed. So actually in the operation rooms, when we're actually doing vascular surgeries, our tourniquets are double, maybe triple this, almost 8 inches wide. and it gives very effective compression without damage from the pain. And what's another thing that tourniquets are important for tourniquets is the location and the situation. So, location, it's not always high up and tight. A lot of military people are taught that because the context of that is active shooter, dangerous situations where you don't have time to look and see what's going on. You don't know what injuries in that arm or in that leg. You just know that it's bleeding from somewhere. In the military, there can be multiple different injuries. There can be blast injuries. There can be multiple different holes. So, yes, do it high, do it tight, get that person to a safe area to fully evaluate them. Often the case, if we have an accident like Mary's son falling off the roof, or people going camping who stab themselves with their knife by mistake, or axe to the shin, which is pretty common for short forest axe, we're able to have the time to expose the wound, see what's going on, and apply a tourniquet 2 to 3 inches above the wound. And you don't need to measure it with a ruler, about 3 to 4 fingers above that wound, you're good to go. And the reason why you want to know this, and the reason why this is important when we're thinking about improvised things, is because improvised devices by design aren't as effective as commercially grade things, and they're not as fast, right? To make an improvised tourniquet may take you several tens of seconds. So maybe 30 seconds, 20, 30 seconds, if you're really good. So since it takes longer, it's very important to do it correctly the first time. And if you do it closer to the wound, you have less beef, less muscle tissue to squeeze to push on that blood vessel. So let's say if you slit a wrist, it's really effective if you have something that stops the bleed just 2 to 3 inches up in the forearm. And one of the common misconceptions is you can't put tourniquets below the knee or below the elbow, so the forearm, because there's two bones there. That is false. So you can definitely do that, and it still provides a lot of good pressure. So if you don't have the things, and which is common for let's say needing more than one tourniquet, because most people bring one, at least one. But once you have a second casualty, once you have a wound that does not slow down, you need two tourniquets up next to each other. So with that, up next to each other, you can have a tourniquet that is wide enough, right? Tight enough at the beginning, and then including that windlass. And what I really like for improvised devices is when we think about windlass, it is literally something that just gives us mechanical advantage to tighten it. So it doesn't need to be anything fancy. It could be a sturdy pen, so something that's thumb thick. But one of my favorite things to use, if you're using material that is long, so think about a long sleeve shirt. If you use something like that, easy to come off, immediately off the shirt, you can immediately tie it. So really quick to apply. But since it's long material, you can also incorporate something that's always on a patient, or typically always on a patient or on yourself, which is their shoes, your shoes. Typically, I would use the patient's shoes so you don't inhibit yourself from seeing other people. So their shoes, tie it, square knot, twist, 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 secure it in place. All right. So that's how you go from having a sense of not knowing what to use when to, okay, I know it is a massive bleed. So we're going to need more than direct pressure. I know the location. So if it's in the neck, in the armpit, in the groin, I'm packing that guy. So you can use your t-shirt material. You can use anything at your disposal. Whoa, almost had a stroke there. At any material at your disposal that fits in whatever hole they have there for wound packing. Or if it's an extremity, you're using tourniquets or improvised tourniquets. And now that you understand that there are certain concepts of what makes things effective, and if you know those things, you can make improvised devices that are highly effective. And if it's front of mind and it's the first action you do while that person's getting direct pressures, you might tell a bystander, hey, put your body weight on this wound while I take off my shirt and tie this thing. Then the chances of you saving that person's life is a lot higher. And that's what we want here. So I hope that's helpful. One of the things is I do want to ask you a question for those of you here, because there's a handful of you who are here live, and we're going to answer your questions at the end of this too. So keep asking questions, which is awesome. Who here is interested because of the topic, and who here are interested because they actually want to master these results? They want to be capable of saving lives, whether it's from a bleed or something else. Let me know if it's interest versus results in the comments right now. Because is it okay if I share what our students are working on right now with you? Because it is something that I think could potentially change your life and your ability to help others. So let me know in the comments, because this is something that is my project and it is my life purpose. And it is the reason why I am so passionate about helping communities, helping parents, helping kids, helping travelers, helping sports people to be more capable of taking care of themselves and taking care of people that they love. And we see people who want results. That's awesome. So the number one thing that I want for you today, because everyone coming here were initially wanting to learn about bleeding. And I won't abuse you with my penmanship, but if we think about these 7 hidden things, number 1, that's bleeding, right? And the other 6, so there are 7 total. The other 6 are still things that could kill you before help arrives. And it is definitely the case in mass casualty situations, in disasters. We're seeing colder climates, we're seeing rainier climates, we're seeing displacements from fires, from hurricanes, from floods. And in addition to that, that doesn't account for what happens when help is uncertain. We have people in North Carolina, we have people on the West Coast, we have people right now in Alaska, native villages, who don't know when relief is coming. And these are 7 things that can kill you before help arrives in a matter of minutes to hours. So what I give my students, what I hope to train all of you in, is what do we do to manage the emergencies? What do we do when help isn't coming? And how do we optimize our medical preparedness based on our personal health issues, our personal health challenges, and how do we become this beacon in our community for medical preparedness? So if that's cool for you, one things that I'm really excited to share with you guys, and I is the first promise that I said, I want to give you a way to learn the skill like tonight. If you cram all this information, it's 7 p.m. right now. You could literally be done by 10 p.m. Massive hemorrhage. So our Stop the Bleed, I am a Stop the Bleed instructor from the American College of Surgeons. And what we have is our Stop the Bleed course. It is just one chapter out of the 7, and you guys can get access to it. Typically, just for a certification in Stop the Bleed, it can be as high as $97, $100. And our field guides, you'll get our field access to our field guides immediately. That's $47 per field guide, and you'll get access to that immediately. But like I mentioned, if you want to learn more than just one thing that can kill you, because let's say you go to an accident and they're not bleeding, but they're dying from something else. If you want to learn the other 6 and you want to learn it well, and you want to learn how to manage that, even though help isn't coming, I want to give you access to our whole survival medicine platform and training program as well. So this is something that we typically do over 10 days in person. We charge $7,000 for it, and it includes a wilderness first aid certification. We now added on a CPR AED certification, which individually costs hundreds to $200, and all our field guide libraries. So multiple field guide libraries that we continually add, we continually update. So you're getting the most up-to-date information. So $7,000 of information that we typically give our in-person students, our certifications, plus our field guides, which sell for about $1,000 right now for our whole library. So you'll get that $7,000 training program, access to all our stuff, $1,000 in field guides, certifications, hundreds of dollars in certifications, over $8,000 just in value right there. But the one thing that students have struggled with in the past, and I'm sure you are struggling with this in one way or another, and currently is accountability. So, who here is trying to learn something, whether that's singing, whether that is a new language, and they just fall off the track and they forget about it, they push it to the side, and just several months pass, and they're like, oh, I really wanted to learn that thing. And my goal for you, since this could literally happen to you tomorrow, could happen to you tonight on your way out or your way back home to the groceries, I want you to be prepared as soon as possible. So, one thing that I'm offering for this group right now who's watching this video is an accountability group. So, every week we're going to go through one topic and you're going to have people in your same cohort. So, this is one class that are signing up this week that are going through this information. And we're going to have the group kind of meetings to push you along the way. And typically, people just to pay for our accountability community programs, it's $47 a month. So, 564 for the year. And you're going to be getting that just for free. And the last thing is you'll need the equipment. Who here just has a first aid kit, right? If you just have a first aid kit, that's not going to save you in a pinch. 100%. But what if you had things that I rely on things that the US Army relies on, and not things that we just get from Amazon or the internet? These are actually things from directly from North American Rescue. This is our military supplier. So you're going to get the best of the best. And not only that, these aren't just off stock. These are customly made for survival doctors, our students. So there's all these added benefits, all these added packages to help you go that extra mile with your patients, with your family. And that is a $250 value. And what I want for you guys to do, because I want you guys to learn, I want you guys to take action, I want you guys to have all the tools that you think you need to be successful, is not only do we have a 30-day guarantee. So if you are not learning, if you are going through the lessons, going to our group meetings, reading the field guides, and you just say, this sucks, number one, let us know. We're going to make some changes. But number two, if it's day 29, hour 23 and 59 minutes, and you're like, I don't like this, we'll give you 100% money back and you keep your $250 first aid kit, right? So that's over $8,000 of value right there. But to sweeten it for you guys, to make sure you are motivated to learn, is not only do you have that guarantee, not only do you have $8,000 in training resources plus accountability, I also want you to be able to win your money back. So let's say we go through this program and over 10 weeks, we learn bleeding, we learn airway issues, we learn CPR, we learn breathing issues, we learn hypothermia, hyperthermia, and we learn all the survival things that you can take for wilderness adventures, but also for suburban disaster preparedness. And you learn all that in 10 weeks and you do the work and you show that you know the skills. You send me pictures, you send me videos. You have a chance to win all your money back as credits in Survival Doctors. And what that allows you to do is to test your skills, your knowledge in person. So you'll be able to come to our exclusive 24-hour simulation and weekend training programs, which is only available to our students. So you can't really buy it outside if you are not a student. And you're able to use your credit to go to that experience. And that will ensure that you develop mastery with what we're teaching, because you're literally getting tactile things. You're sleep deprived a little bit cold in an environment that you may not be familiar with. And you are not only practicing your medical skills, you are learning, relearning, fine-tuning your survival skills as well. So if that sounds cool to you, I want you to go to www.survivaldoctors.com/join now. So I'll put it here in the comments, www.survivaldoctors.com/join today, I believe. Let me double check. Let's see if that's good. Yep, join today. And I'm going to share my screen to show you what it looks like. And I have one more present for you guys. So stay tuned. Share screen. Okay, guys. So this is what it looks like. Very simple. You can put your first name, your email address. Tell me where you want me to ship your stuff if you join with our bundled program. And there's options for everyone. If you just want to dip your toes in, you can literally learn the Stop the Bleed stuff for free. We're not charging your credit card. All you need to do is click the Essentials pack, try the 30 days, and if you finish the Stop the Bleed training, and if you continue with us after the 30 days, I will send you medical gear. I'll send you a tourniquet as well, just for completing that to help you out. We have our quick start incentive. If you are ready right now and want to learn, want to invest in us, want to invest in what we're trying to do for our community, $47 a month. This is half off what our regular rates are. And again, if you complete your Stop the Bleed training and you stay with us more than a month, I will send you a top tier tourniquet. But if you want to get more training time, so what we're going to do is give you 1 month free of training. So you'll pay for 11 months, but get 12 months free, or 12 months covered. And you'll get a $250 training kit. So that includes all the Stop the Bleed stuff, other trauma stuff, and some other goodies specific for our group. And it's that simple. We got a 30-day money back guarantee, but not only that, earn your money back. Earn your money back. And if you want to just spend $500 in trauma packs, do that. If you want to come out and learn with us in an environment that you're not familiar with, to really not only test yourself, but to get direct feedback from an ER doctor, from a veteran, from a survivalist, do that. So this is something that I am just offering through the people that are watching this video right now. It's only for you guys. So that's www.survivaldoctors.com /join-today. And you can also get there through this one. This gives you a little more information about our whole program, survivaldoctors.com /lifeline -3. I'll give you an overview of everything. So with that, I want to answer some questions because you guys are been patient. We have a question over here. Where is your course physically located? So we have training facilities primarily in Maine, but we're also opening facilities in Michigan as well. So if you stay on and you're like, hey, Michigan's a little closer, awesome, we can do that. But like I said, this is for our cohort right now this week. So anyone who sees this video in the next week, they'll be in your class. And if you guys are in a location that's close, I literally have contacts and trainers throughout the country, and likely the case in your state as well. So if everyone wants to go to Montana, I would love to have an excuse to go to Montana or Utah. I would go there if we have at least 10 students there. But right now, our main training location is in Maine, which is an awesome location because we can do ocean stuff, we can do woodsy stuff, we can do rivers, we can do lakes, a lot of variety over there. Good question over here for content. How many hours can a tourniquet be placed before tissue death occurs? Surprisingly, a lot of hours. So for you to need an amputation, it is on the scale of like multiple hours. The goal right now, and this is from the Tactical Combat Casualty Care, that this is where I get a lot of my recommendations, both from the American College of Surgeons, but also from the TCCC, which is what our military uses. Our goal is to have the tourniquet on and have a plan to get it off within 2 hours. So if you're a civilian, if you're in an urban spot, really easy, make it tight, make sure that there's no pulse. So that is what a tourniquet is by definition. So tourniquets stops the bleed, stops the blood flow. Your goal is to coordinate care so that they get to an ER, get to a provider, get to a medic within 2 hours. And they'll be able to convert that to a pressure dressing. So if you want to learn details on how to make a pressure dressing, again, survivaldoctors.com/lifeline. There is an option, lifeline-3. There is an option where if you just want to see what the bleeding course is like, you can do that. But if you want to join and get all the cool free stuff and be a part of a class, then go for the yearly option. The question is to use or not to use a tourniquet. And yes, if you know what we talked about today, it is in a location and we classified it as a massive bleed, go for it, right? Tourniquets are first line for that specific criteria. If it's a big amputation in the leg, direct pressure is not going to solve the problem and you're going to lose more blood. And that's a big issue if there's multiple casualties, if help is delayed, if there's a disaster in the zone. So super, super important. And awesome to mention, Greg, not only do you want your trauma equipment, you want your boo-boo kit because that's going to be a lot of what you're going to be doing. And one of my favorite field guides that I've written to date is a master list of what I carry in my home pack. So this is what goes in my home or my truck, an expedition pack, and my everyday carry. So it's literally a checklist of all the things that I recommend, including medications and doses, including antibiotics. So if you are the type to go to Jace Medical per se, and if you want like a 20% discount, this is a little surprise for you. And I remember there's still a surprise that I want to share with you guys as well, because for those of you who are staying this long, you deserve this 100%. But just sidetrack, Jace, if you want 20% off, use the code survival doctors with an S and you get 20% off. So that's an amazing deal. I don't think any other affiliate gets that deal, but we're able to get that for you. And I don't even think I get commission off that code. So that's for you guys. All right. And yeah, people who use sharp tools and who are clumsy, definitely something to learn this stuff. All right, guys. I hope I'm getting all the questions over here. We got some people from Ontario. The purpose of CPR is to keep circulating blood around the body. If someone is unconscious with a big bleed, should you do CPR? Yes. So the reason why we teach you a system, you saw those lists of 7 things. There are going to be 7 things that you very quickly identify and you treat. Typically, bleeding comes before circulation, whether that's through the advanced trauma life support course or the March algorithm through the military. So bleeding typically comes first. So identify the bleed, stop the bleed, and if you notice that they don't have a pulse, then you start CPR to make sure they're circulating oxygen to the brain and to the other organs. So absolutely, Jason answered this one. Stop the bleed first. Awesome, guys. This is such a good question. And how about I share with you my surprise after this question, okay? So, number 1, what are your thoughts on periodically loosening and to restore some blood flow to increase limb survivability? Oh, I love this one. It used to be once it's on, it stayed on, but I've seen more recent material saying otherwise. So, I want to dispel this because you have to approach this in one way. One way. And one thing that we've seen, and surprisingly, I'm not going to name the show. I'm not going to slander any show, but this is a show that is a very realistic ER show, and I love it. I even learned new stuff watching that show. But there was one scene in a mass casualty event where I think it was one of the nurses said that every hour loosen the tourniquet a little bit, and that was a red flag because what happens when you tighten and loosen? Basically, you cause something called reperfusion injury. And it is similar to if you rewarm and freeze a limb. So like if you have frostbite, severe frostbite, and you warm it up, you go outside again, gets frozen again, and you keep on doing that. It doesn't increase limb survivability. It actually decreases limb survivability. You cause more damage because there's a bunch of breakdown tissue, and you kill off that hand or leg or foot a lot quicker. So don't do that. What you do is, let's say you think of, hey, this is going to be more than a few hours. I'm in the middle of Alaska on a hunting trip, got an axe to the shin, bleeding heavily. I know it's a massive bleed. I know it's on an extremity. I have a tourniquet on. You have one shot to see if you can transition it to a hemostatic pressure dressing. So that is your loosening. So if you know how to do that, and you can literally learn it right now before bedtime, um, do that and slowly loosen the tourniquet. And if there's no bleeding through the bandage when you loosen it, and keep it there just in case you need to redo it, then you're good to go. But if it rebleeds, then tourniquet goes back on, you write the time again, and it stays on. All right. Good question. What brands tourniquets do you have there? So for the Stop the Bleed kits, we have I believe it's a Gen 7 CAT tourniquet. So that's the combat applicator tourniquet. That's standard use in Canadian and also American Armed Forces. The one that I have over here, this is, I like this guy. This is called the SAM XT from SAM Medical. Two good tourniquets. If you're looking to see price point differences, typically the CAT tourniquet, you can get multiple. You can probably get two for the price of one of these. But I upgrade you guys for these. I give you one of these if you do the yearly program or the yearly payment. You can look to see what brands you like and what brands are approved by just Googling T Charlie Charlie Charlie. So that's T triple C Tango Charlie 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 recommended tourniquets, and there should be, I believe, like 6 or 7 tourniquets that are approved and recommended and have been war tested. Do not do rats tourniquets. That's the only one that I would say I wouldn't recommend. But there are several that you can choose. And a lot of you guys want results, so I hope we get to be in the next class together. Yes, efficiency in stopping the bleed is definitely something that you want. And I talked about my surprise for you guys, because I know people, we've had people who said like, "Hey, I love what you guys are doing. I love what your program offers. I love getting free trauma equipment, but I just can't afford it." So what I have for you guys is a special giveaway just for the people watching this video right now. If that's your situation and you're like, "I can't afford this right now," send me a message, whether it's through Instagram, or you can literally text me right now over here at 207 with your story, why you want to learn this, why you think you need this, why you can benefit from this. And we're going to have a grand prize, someone who goes through this program for free. And you can increase your chances of winning if you just tell someone who registers. And if you have someone who registers, whatever they register, if they register for a monthly payment and if they register for a yearly payment, you guarantee to have that membership for free. So you get all the stuff, you get all the coaching, the group coaching call, you get the bleeding control kit, you get all the upgrades, you get an upgraded tourniquet as well. If someone who you refer joins our program. And if that's interesting to you and you want to go that route and get sponsored for that, that's one way to do that. And you can text me, tell me your story, tell me your situation, and I will send you the link for our affiliate program and enter you in this giveaway for one person who gets the whole program. And the second prize will get trauma gear. All right. So if that was valuable to you guys, let me know. If there's something else that you want, that you need, let me know as well. So one of the questions specifically for tightening and untightening, loosening the tourniquets is, we know about the toxins from the broken blood vessels and the broken muscle cells that cause problems in the organs, causes more damage to your arms and legs. But what about throwing clots? So clots would go from your body to your heart to your lungs. So that's probably not good because you can get lung clots, and depending how big it is, that could cause some breathing issues. Typically, we don't see that in the very acute phase. So, like, think about the first few hours. Um, but eventually, yes, that could cause an issue. And if you have a hole in your heart, it can go up to your brain, cause a stroke. That's also an issue too. So, ooh, awesome. So we have someone interested in sponsoring one of our trainings in Idaho. Idaho. That'd be awesome. Thank you. Text me. We'll link up. So, what are my thoughts on Slishman wrap as an improvised tourniquet? I'm not familiar with that. Let me Google that really quick. Slishman, huh? So, if it's wide enough, if there's a tightening device or a mechanism, whether that's an elastic, a ratcheting, a windlass, typically that'd be helpful. My Wi-Fi is a little bit slow right now, but yes, I agree. Really good questions. Really good questions. And absolutely, bystander effect is real. That's why the people who join our program today, within all of you who are learning this stuff, you will be the people who stand up when there's bystander effect. And bystander effect is everyone just watching and not really doing anything until someone speaks up and then everyone starts moving. You'll be the person who will take the lead, who will delegate, and who will save lives. So that's the types of people who we are trying to train. All right, let's see if this. So it's not pulling up on my Wi-Fi. It's a little slow because I'm streaming, but I hope you guys found this valuable. I hope to work with some of you, and I hope you snag this deal before someone else does, because I'm only offering it for the people who watch this video, for the first 20 people. All right, because yeah, I want to make sure that we have enough people, but not too much people to get some one-on-one attention. So with that, I'll see you guys next time. If you like these lives, let me know. I'll do more of them. Thanks, guys.